In 2021, we will have a type of vaccine that we use. This vaccine called mRNA instead of the part of the bacteria or the virus. mRNA is a type of RNA necessary for the production of the protein in the cells. mRNA uses information from the genes to create the blueprint for making these proteins. In this time, we have two vaccines, the Moderna and the Pfizer vaccines. The companies that we make these first COVID vaccines make these vaccines in Europe and in the United States. Well, after results of their clinics, these results show the effectiveness of more than 19%. Their investigations are revolutionary. The mRNA molecule that they have managed and systematic to trigger an immunology response. We can see the Dr. Benzel. He reading and investigate about Wuhan virus, and he asked his team for a vaccine proposal in 16 days. Wow. And we can see another doctor is Ugur Sahin. Ugur Sahin is a Turkish scientific who created the German vaccine. Ugur Sahin read about the virus knowledge origin in China, and he understand that the pandemic was knocking of the door. He discussed it with his wife about this, and he is the medical director of the Biotech, the German biotechnology company they founded together with his wife, and he didn't feel like it was an opportunity for they to rather and duty themselves. He explained that they put like more than 50,000 of their employees to work on what they call the Project Spin of Light. A few weeks later, that they partnered with the Pfizer, they developed and distributed this vaccine.
Hello, I'm going to talk about mRNA vaccines and how they work. Every form of life is made of small pieces of information called genes. We can classify genes in DNA and RNA. DNA stands for desoxyribonucleic acid and RNA stands for ribonucleic acid. The M before RNA stands for messenger. mRNA vaccines work by introducing a piece of mRNA that corresponds to a viral protein, usually a small piece of a protein found on the virus's outer membrane. The mRNA is delivered by a co-formulation of the RNA encapsulated in lipid nanoparticles that protect the RNA strings and help their absorption into the cells. By using these, cells can produce the viral protein. As a part of a normal immune response, the immune system recognizes that the protein is foreign and produces specialized proteins called antibodies. If our body gets infected by viruses or other pathogens, antibodies will help to protect it against them by attaching to them and marking the pathogens for destruction. Once produced, antibodies remain in the body, even after the body has rid itself of the pathogen, so that the immune system can quickly respond if exposed again. If a person is exposed to a virus after receiving mRNA vaccination for it, antibodies can quickly recognize it, attach to it, and mark it for destruction before it can cause serious illness. For a vaccine to be successful, sufficient mRNA must enter the host cell cytoplasm to stimulate production of the specific antigens. Entry of mRNA molecules, however, faces a number of difficulties. Not only are mRNA molecules too large to cross the cell membrane by simple diffusion, they are also negatively charged like the cell membrane, which causes a mutual electrostatic repulsion. Additionally, mRNA is easily degraded by RNases in the skin and blood.
I'm going to explain you the difference between conventional vaccines and mRNA vaccines and how they teach the body to defend itself against a virus. The conventional vaccines, they use forms of the virus or bacteria, either inactivated or in a specific protein. Think of it like showing a picture of the virus to the immune system so it can recognize it in the future. For example, if you receive a conventional vaccine, your immune system will learn to recognize and fight the virus by encountering these parts without causing the disease. On the contrary, mRNA vaccines, they use a small fragment of genetic material called messenger RNA that contains instructions for the body cells to make a protein from the virus. For example, if you receive an mRNA vaccine, your cells will use these instructions to produce the viral protein, and then your immune system will learn to recognize and combat the virus based on this protein. The basic difference in simple terms is that conventional vaccines use parts of the virus of bacteria, and mRNA vaccines teach our cells how to make a small piece of virus to activate an immune response.
Good night. I am Dr. Araceli Morales, geneticist. Today I will provide future perspectives and the potential of messenger RNA vaccines beyond COVID-19. The success of RNA vaccines against COVID-19 disease has opened the door for their application against a wide range of infection diseases, including influenza, Zika, and even HHV. Additionally, RNA vaccine technology holds promise beyond infectious diseases. Research is being carried out to develop treatments with RNA to combat diseases such as cancer, liver disease, diabetes, among others. If we manage to direct the RNA messenger, more effective medications can be designed to produce specific antigens to modify damaged cells, thus directing the system immunological to attack and destroy tumors. This technology could revolutionize the way we approach disease prevention and treatment, offering personalized and highly adapted solutions. It's considered that in the future we will stop using traditional vaccines. It's natural that there is some distrust among the population, coupled with some content that circulates on social networks, whose sources are not reliable, and that can sow some doubt and fear regarding this innovation. If science had not given way to new techniques to combat diseases, we would not have the new medications, nor would we have reached so many people immunized against COVID-19, and many more lives would have been lost.
Hi, I'm going to talk about how mRNA vaccines has changed people's life and how they really impact humankind. If you had told me a few years ago that mRNA vaccines would revolutionize how we tackle pandemic, I might have wished for it to be true. But could I have ever imagined the speed of which this vaccine development? I certainly wouldn't have thought so. It's quite astounding how rapidly Pfizer and Moderna mRNA vaccine emerged, and while I wish this technology had been available soon, the reality is they arrived just in time to mitigate the COVID-19 crisis. The global impact of these vaccines is nothing short as a marvel. I often wish the world didn't need to face such a crisis to realize the importance of scientific research and international collaboration. Yet here we are. These vaccines have saved countless lives, allowed economies to reopen, and provide a beacon of hope amid the pandemic.